Thank you everyone for being here today for our webinar, Building Interprofessional Coalitions to Create Change in Healthcare with Dr. Alicia Valenti. Just a couple of housekeeping items before we get started. I am currently recording this webinar and it will be available in the Graduate Studies Support Center Skill Up page, typically within 24 hours. Also, we do have live transcription available. If you're interested in the scrolling subtitles, you can turn these on. If you hover over the bottom of your Zoom window to see the controls, then you can click the CC option and choose Show Subtitles. You can also turn these off at any time. And with that, I will turn it on over to Dr. Valenti.
Hello, everybody. It's great to meet you. My name is Dr. Alicia Valenti. I am an assistant professor at the UMass Chan School of Medicine in the Department of Emergency Medicine at the University of Massachusetts. I graduated residency in 2016 from the University of Pennsylvania. Afterwards, spent 4 years in the Indian Health Service in Northern Arizona, and now I'm back in academics at the University of Massachusetts. My academic focus is health equity with more of a focus on community engagement, community organizing, public policy, and diversity, equity, and inclusion. I'm giving this talk to you guys today about a really exciting project we have going on at the University of Massachusetts that I'm spearheading called Safe Worcester. And through this presentation, we're going to talk about how I built this coalition, how our different team members get together in this coalition, and sort of how we're really engaging in the community to help health outcomes. Okay. Oops, let's go back. So conflicts of interest. Nobody's paying me for this. A lot of the source of theory in this presentation is from the Health Equity Scholars Program that I took to gain a lot of these skills. I know there's a lot of different models of leadership, a lot of different models of team building, but this is the one I know, this is the one I follow, so this is the one I'm presenting on today. And lastly, I truly believe in this stuff. So while I was working for the Indian Health Service, working in a community with high need, you have the privilege and the opportunity to use social determinants of health in every single clinical decision and realize that you cannot create good health outcomes for your patients or the community without being wholly community engaged. When I came to the University of Massachusetts, I wanted to add that to my clinical practice and to my academic focus and use my privilege as a physician to elevate the voices of those who experience health injustices and then help them advocate for themselves to create structural change, just to help to eliminate health disparities. So this is one of those endeavors. So the objectives today. One, I want you guys to understand the large scope of a comprehensive program because the program I'm going to lay out for you is huge and has a lot of moving parts. The second, we're going to conceptualize on how coalition building is achieved and what it takes to build a coalition, and then also appreciate that there are different models of leadership and different models of team building. So first, as with any coalition and with anything that's passion forward, it starts with a story. So I moved to Massachusetts in 2020 and started at the University of Massachusetts a week before the shutdown with COVID. And I'm an emergency doctor. So it was a crazy year. And by the summer of 2021, I had just bought a house. Everybody was itching to get outside. And I remember being outside on the front porch with my son. And I live about a block away from a pond. And my son at that time was about 2. And he really liked watching the trucks go by. Our street in front of our house is a little bit busy. So we were sitting on the porch and he starts saying, "Fire guck, fire guck." And I look and there was 1 fire truck, and then there was 2, and then there was an emergency response vehicle with a boat behind it, and then an ambulance. And I looked and I'm like, oh crap, somebody drowned. And by the robustness of their response, it's probably a kid. We find out the next day that it was a 16-year-old who went on a rope swing, fell into the pond, realized he didn't know how to swim once he was in there and drowned. My neighbors tell me that he was recently resettled from Latin America, and his father was out there audibly crying for night after night after night after that. Less than a month after we had a tragedy in the city that I work, Worcester, um, a police officer, Officer Familia, died while trying to save a 14-year-old kid who was drowning in a local pond. Apparently, the officers had no water safety equipment in their cars. He jumped in with multiple teens that were drowning, and unfortunately, he and the one teen both succumbed. So this got me thinking, I have skin in this game, and what the heck is happening? I grew up on the Jersey Shore, where, like, when I was a teenager, we were dumb. We would jump off bridges into marinas. Nobody ever drowned. Whenever we heard of drownings, it was be like some vacationer who came in, nobody local. So what is this problem? And I just thought to myself, how big is this scope? So the first thing I looked at was the CDC, and because the CDC has data on a bunch of injuries, including drowning. And looking at Massachusetts, it doesn't look like there's too much, right? But I thought to myself, there has to be more granular data than this, because where I live, I personally witnessed 3 in a month. So there has to be more than this. But because of information blocking, you can't get any more granular. So then I went through the news. It turns out in 2020, 125 people died in the state of Massachusetts, secondary to drowning. Before that, the average was like sort of in the 60s to 80s. So this was a huge jump. And in 2021, between May and June, there were over 40 drownings in 1 month. So this problem is just getting bigger and bigger. And then I looked at the stats. So it looks like communities of color and low-income communities have higher rates of drowning, and they're also less likely to know how to swim. In fact, if your parents don't know how to swim, you are 80% less likely to learn. Also, in Massachusetts, farm-born individuals are way more likely to drown. And if you look at the CDC statistics, it says almost all children, whether or not they're going to know how to swim, will visit a body of water yearly. And teens have even more staggering statistics. So I wanted to look at teens because those were the drownings I knew of. So it looks like drowning, in terms of how it's laid out, the risk is bimodal. So first, it's kids under the age of 5, little kids toddling around, falling into pools. And then after that, it's teenagers. Teenagers usually die in natural bodies of water, like oceans, rivers, lakes. They also die secondary to increased risk-taking behaviors, like the 16-year-old down the street from us who died jumping off a rope swing into a pond, secondary to substances. And they also, because of this increased risk-taking behavior, they die at the same rate, regardless of their ability to swim. And looking through the programs that were out there, I didn't see any program tailored towards teens. All the learn how to swim programs are like geared towards like little babies where you put your face in the water and blow bubbles. And then I looked at our city. So I work in Worcester. Worcester is the second largest city in New England, outside of Boston. It has a 20% poverty rate. About 20% of the folks who live in Worcester identify as farm-born. And we also don't have any public pools. We have 5 natural bodies of water, 5 ponds that are set up as swimming recreation areas every summer. And to boot, we're also the largest refugee resettlement area in the Northeast. So in the summer of 2021, there was 2,000 Afghani refugees who were relocated to New England, and most of them were settled around Worcester. So I'm thinking to myself, oh my gosh, we're having so much risk, and this risk is just growing. So then I looked to get more granular data because, again, I'm a health scientist and I move by data. I want to see the scope of the problem. So I called around to some of my colleagues and I called around to the EMS folks because being in emergency medicine, we work very closely with EMS, and a lot of our colleagues are also EMS coordinators. And I looked at the run sheets between 2015 and 2021 of the drownings of one EMS company, which is the biggest EMS company, Worcester EMS in the area. And this is sort of the stats from those couple of years. And if you look, there are a lot of drownings for these kids that are in the above 5 and less than 18 age group. So this made me think a lot. And the biggest thing that it made me think of is I don't know what the heck to do about this problem. I identified this problem. I identified a problem that's likely to grow because we are having more and more refugees coming in, and there are more and more people who are going to live and grow up in Worcester and don't know how to swim, and that's the only place to go when it's so hot in the summer. And plus, I live down the street from a pond myself. I don't want my kids to be a statistic. What do I do about this? So the first thing I did was I got skills. As a physician and as a clinician, I'm really good at working in the ER, but I know nothing about community organizing. I know nothing about building a team. I know nothing about analyzing this stuff. So I was in way over my head. So I was lucky enough to write this up and get accepted into a program through the Cambridge Health Alliance at the Harvard Center for Health Equity, Education, and Advocacy. And this was a cool program. It was a mid-career program. It had a fairly large cohort. I think there was 50 of us. Half of us were physicians, half of us were non-physicians, all health scholars, all working towards health equity problems. And they taught us about how to engage in a community effectively, how to effectively structure a program, and gave us really good mentorship about how to get it off the ground. And a lot of the theory that I'm going to tell you is from this program. So the theorists that they focused on in terms of creating coalitions was Marshall Gantz. So if you think of Marshall Gantz, he's sort of like the Steve Jobs of the community organizing world, right? He went to Harvard for like a year, decided Harvard isn't for me, went back to California, joined the farm workers movement, was there for 15 years, and then later in life went back to Harvard and got a PhD in sociology. And now his whole expertise is teaching people how to lead, how to build effective coalitions, and how to create systemic community and political change. So my first question was, all right, this is a big problem and I need a lot of people. So how do I organize a coalition? So first I had to think of definitions, right? Because you need to know words and definitions of words in your head in order to communicate effectively with people and in order to really make something happen. So what I knew how to do is I knew how to mobilize. Mobilize is when you deploy somebody else's resources. That's when you go to like a canned food drive and give cans. It's when you sign petitions. It's when you plant trees, right? Organizing is different. Organizing is building new relationships, building new teams, building new leaders. And this requires an entirely different skill set. So Gantz said there were a couple strategies that were key in order to build an effective coalition. One, ask who are my people? And he concentrates on people instead of problems, because what you're doing is you're trying to correct injustices, and injustices center around people's experiences. So in order to truly correct that injustice, you need to see what people are your people that experience personally that systemic injustice and lift them up. Second, what change do my people seek? Like they're experiencing this injustice, what change do they think they need in order to correct this injustice? Because again, you can't be an outsider looking in and create a coalition and expect it to thrive, right? You need to have it community focused. Third, where can they get the power? So the whole thing with coalition building is there's an injustice there because there's an imbalance of power. How do you get power on the side of those experiencing systemic injustices? What tactics do they use? What makes the power listen and come on your side and help you mobilize their power for your good? And fifth, what is their timeline? Does this need to be done by a certain date? So I kind of adapted this to my needs. So first, I knew what I wanted to do. I knew what was needed, but I didn't know any of the people that were affected, right? Like this is a big disconnect. And then I had some idea about the power, but I didn't know who had the power over my people or the power to change this problem. I just had sort of a nebulous idea. I didn't know how to build a relationship to that power. Once I had the power, I'm like, well, what are these teams going to look like? And then I didn't want to do this all by myself because I have a life, I have kids, I'm a clinician. I could not make this my full-time job, and the scope of this problem it would be. So first, let's look on my people. So my nebulous idea of who are my people are, okay, this is easy. It's teenagers with this nice to the right stock photo of teenagers. I thought this was kind of funny. The second are folks who are foreign born, folks who are recently resettled, and their parents. And then third is the people who care about them. Not only the parents and youth organizations that focus on mentoring and fostering good relationships with teens, but also the medical community who focuses on injury prevention and doesn't want to see tragedies happen because drowning deaths are preventable. So to get in touch with my people, again, I used my privilege. So as a physician, it's really easy for me to talk to other doctors, especially within my institution. So I was talking to people on shift about this, and I'm like, hey, I want to talk to somebody about swim in this community. Who do I talk to? And everybody was just like, oh yeah, talk to the head of DPH, Dr. Hirsch. He's a trauma surgeon, and he's great and super friendly and loves mentoring. So after 5 failed meetings, because in between being the director of public health and being a practicing surgeon, I got all my meetings canceled, but I was persistent. And I finally sat down and talked to him. And I sat down and talked to him armed with all of this data that I had before that I showed you, like the data on teen drownings, the data on stats in Worcester, why we are so at risk. And he just stopped me. And he said, Alicia, nope, everybody knows that this is an issue. Just nobody has taken up the helm to tackle this yet. What I want you to do is go to this launch program. So it was October, and at the end of October was the Coalition for a Healthy Greater Worcester launch program, which is a launch program of like city individuals and individuals that do a lot of community work in the city, kind of getting together, networking, and seeing how they can grow, health strategies within the city as a whole. So here I am. At this point, just to give you a little personal note about this story, I am like 9 months pregnant. I was due to give birth to my second kid at the end of November. So I'm sitting here and I'm like, okay, I need to go. But what do I do once I get there? I'm just this pregnant lady. So I had to think and prepare myself for these meetings and how to effectively network. So there's a saying that in order to engage the head and the heart, or you need to engage the head and the heart to use the hands. In other words, you need to show somebody it's a problem with statistics, but you really need to engage emotionally with their gut and their purpose and their morals in order for them to join your team and work with you. So I had to create a narrative. And if you look at Marshall Gantz's theories, he has a lot of different steps to how to create an effective narrative and how to use that public narrative in order to build relationships and get people to join your coalition. But I parsed this down into what I did because I have a very short attention span. I realized that in order to get people to join this cause, I first needed to understand why I did it, my motivation and my values. Because if I'm not authentic, everybody's going to see that I'm some fake person from outside of Worcester who is, for some reason, trying to promote anti-drowning. And I don't know if they think I would do it for some like other reason, like career building or something like that, which is not the tactic I was after. So I got my public narrative together. I went into this meeting. I networked with a bunch of people. I talked to about 10 people over the course of 2 hours here. And what I realized was, one, everybody knew it was a problem. As soon as I went in with my statistics, everybody was like, just stop. We know that this is an issue. And the other thing that I loved is everybody understood it was both a public safety and an equity issue. They understood why Worcester was more at risk, why our communities of color especially, and why our communities of recently settled folks were more at risk for drowning, and why we had to have this program to protect everybody in the city. Third, I realized what barriers we had. Apparently they had had a swim program before. The swim program was a passion project of somebody else. And it shut down because, one, it was super expensive to bus kids. It was super expensive to have lifeguards. It was super expensive to have swim training programs. And two, because the same kids didn't come every week, there was no way to measure outcomes. So they couldn't get continued funding. And then, of course, the pool broke down after that. So then they were like, oh, I guess we're not having it anyway. And then the other barrier I noticed was they can't get lifeguards. At this point in Massachusetts, and still, like, cities are offering $25 an hour plus paying for training for teens to become lifeguards, and nobody's taking the bait. And everybody's scratching their heads like, what, this isn't cool anymore? And then lastly, they really wanted physician engagement. They were like, thank you so much, Dr. Valenti, for coming out, because we see that big hospital up on the hill, but nobody ever comes down and talks to us. We are so happy you're here, so happy you care about this community, and so happy you want to be on our team. So it was overall really positive, and I was really jazzed about this networking event. And I also got a power connection. I connected somebody who could help me not only engage more in my people, but could also help me work to change the paradigm. And this was a woman who was the head of the Division of Youth Opportunities. So let's get into a little bit of power. Who can change the paradigm? So when you think of power, you think you have to identify what power you need, right? You want all your relationships to be intentional. You don't want to waste extra energy. So one, you think, what do we want? Two, you think, who has the resources to create the change? Who holds the power? Three, what do they want? And four, what resources do we have that they want or need? Because again, you're creating a relationship with power. This has to be reciprocal somehow. So when you think of power, you think of what power listens to, right? So scientists, health scientists, which I know a lot of us here are, business people, economists, they all listen to data, and data which supports their outcomes, right? Like for health scientists, you want to see how it prevents deaths, increases health outcomes. For business folks, you want to give them data to show how it increases their bottom line. For politicians, it's a little bit different. When you want to make political change, and I'm sure you guys see this all the time on the news, you want to have a compelling story, right? Because politicians who have a lot of power are pummeled with statistics. What they grab onto and what then moves their constituency, right? Moves those hearts are the stories. So I had to figure out who I had to share what with and have all of that data at hand, right? Either the story or the data, and the data with which that has which outcome in order to appeal to power. The second thing you can do is power map. So this is a pretty cool concept of power mapping from a website called Beautiful Trouble, which is a community organizing website. There's a lot of really cool ones out there. And basically what it has is it has you and the target. And what are the intermediary steps to you and the target? And who do you need to build relationships with? So to give you an example of how this works, right? Let's say you want to mandate that everybody gets tested for COVID-19 in your state, right? Like let's just put that out there as a thought experiment, right? So you think, okay, so who holds the ultimate power to make that decision? The governor, right? Then how do you get to that decision? Maybe you can talk to like somebody you know who is a press person who can then write an article to appeal to the governor. Maybe you know somebody who has a connection with the Department of Public Health who then can get in with the governor. So that's what power mapping is. It's doing that step-by-step relationship and seeing how you can connect those dots in order to get to power. So when I power mapped, it was a little bit bigger than just me and one problem or one person, right, to get my problem solved or my people's problem solved. Because as I said before, with teens, they drown at the same rate, regardless of their ability to swim, right? So you need a comprehensive, multi-pronged program. Just teaching them how to swim isn't going to cure anything. So I thought, okay, first I do need to get people in the pool. So who holds the power to get people in the pool? And that's city pool organizations, parents, schools, folks that are engaged in pools, right? Like appealing to parents to get those kids in pools. Second is, how do I get kids to learn about water safety and CPR? Because CPR is such an important part of drowning prevention. You need to know how to save a life. And I'm like, okay, how do I get in touch with these kids? You know, I have to get into schools. I have to get in touch with youth organizations. I have to get in touch with CPR certification agencies to see if they can certify these kids and how much it would cost. There's a lot of different powers at play there. And then the third is signage, right? Because you want the public messaging around drowning to change. So then I'm like, okay, who controls public messaging? That's the city of Worcester. That's Parks and Rec, who are in charge of the ponds that people recreate in. So there was a lot of different power to kind of look at here. So next, I knew my people, I knew the power, then I had to build relationships with this power. So when you think of relationships again, you want them to be intentional. And everybody knows how to make relationships already, right? As humans, it's what we do all the time, every day. So take, for example, you're at a destination wedding, you go by yourself, and you're sitting at a table and there's somebody else sitting at that table with you who also is obviously by themselves. The first thing you ask is, how do you know the couple, right? That's a shared value. You both value your friendship or your relationship with that couple, and therefore you came to this wedding, right? And then you start to have an exchange of interest and ideas. You start to talk, right? So, maybe we're in Denver and I'm like, oh, I came here not only because I love the relationship I have with these people, but I also really like hiking. Do you like hiking? The other person's like, yeah, I love hiking. In fact, I'm going to go tomorrow. And I'm like, interest in resources. I didn't do my background research on where to hike. You did. So maybe we can exchange those. And then we create a commitment. I think this person is a nice person to hang out with. So tomorrow we decide to meet at a trailhead and go for a hike. And then if you value that relationship, you have constant attention and work. You do something to keep that relationship going forward. Now, a lot of people do social media or whatever it may be, right? So the goal of these intentional relationships, just like sitting down at that table, is the one-on-one meeting. You really want to give attention to somebody. You want to engage in their interest, especially if you want them to join your coalition and join your cause. You want to explore their interest. Again, explore what their values are, what your values are, and how they align. Get those hearts to align, get that purpose to align, and then get a commitment. You want to always, at the end of a meeting, get a commitment to, one, a next meeting, and two, the things that you will accomplish and the things that you will then work on until the next meeting. So you can then start to have a working relationship with shared interest to engage on going forward. And the goal for this is to expand your circle of support, because the more resources you gain, the more power you have to change and the more power you have to change for your constituency. So I had a lot of one-on-one meetings because I just called and called and picked up the phone and picked up the phone and picked up the phone. So my first set of one-on-one meetings, again, after I was at the networking event, was I met Raquel. I then contacted Raquel a couple months later. It was a good thing I was pregnant because I was like writing an email saying, hey, remember that pregnant lady? And she allowed me to get in front of 40 teenagers, 20 at a time, who were all like youth leaders. They were being trained to be camp counselors in Worcester. And I paired with one of my colleagues who is trying to spread the word for hands-only CPR. So we both did sort of a combined thing of hands-only CPR and water safety training. On the second day, I got a call from a med student who was like, oh, Dr. Valenti, I heard you're doing this. I'm really interested in some education. Can I come too? So he helped me give the second lecture and then introduced me to his mentor, who is the head of the Division of Pediatric Trauma Surgery, who called me up independently and was like, this is awesome. We want to give all of our resources to you and partner with you to make this the best it can be. So I was like, okay, this is cool, but this is happening fast. How do I organize this into teams that work? How do I keep this momentum going and not just have it fall on its face? So if you look at teams, you have to think of a good team structure, how to make effective teams, and then what's the outcome of your team, right? So for structure, you wanted to have a clear purpose. Our purpose was anti-drowning. You want to set ground rules, right? Like a lot of the teamwork literature talks about ground rules of what to do in case there's a conflict, how to contact each other, if you want to do email, if you want to do texting, and goals. And it's always good to keep those written down somewhere. So in case your team starts to get off track, you can then go back to the shared purpose and shared goals and then continue on to where you are and keep them in front of you in case they change, because you want it to be flexible. The second thing is you want your team to be effective. And the markers of an effective team are, one, they're bonded. So you have to have something that keeps that team together. The team has to be stable and it has to be interconnected. And because of this, they say that the most effective teams are about 4 to 8 folks, because outside of that, it's really hard to keep a group stable and interconnected. And then 3, you want to have outcomes, right? You want the team to have the output that it was supposed to have, right? And you want to have some measures that your team is actually achieving goals. You want it to have the capacity to achieve these goals. And then you want to have some sort of leadership development in this team as well. And I gotta tell you, this is the hardest part. Going from this one man or one woman coalition to a team takes a lot of strategy, a lot of organizing, a lot of having faith that somebody else has the same passion you do about this project. And because I didn't know how to do it, I then had to think of, okay, how do I lead this team? How do I have the faith to make this work? And especially in a way to not make this my full-time job, because a three-prong approach to anti-drowning, like I said before, is huge. So Dr. Gans says that there's three types of leadership, or at least that's the type of leadership that he identifies, right? One is the I'm the leader. Everybody points back towards you. That's something I didn't want, not only because of time constraints, but also because if everything points back to you, it's really hard for your organization to grow outside of your own values. It's really hard for it to be flexible, and it's really hard because there's no room for creativity and, new and innovative ideas. The second form is we are all leaders. In other words, everybody mans their own team. And that's really hard too, because when everybody's a leader, there is no shared purpose and no shared goal, or it's really easy to lose sight of that shared goal. So the third structure is the structure that I kind of went in, which is more the snowflake or the interdependent leadership model, where there's a core leadership group in the center that then each grows leaders that then lead their own core group of leaders. And this was very nice, especially for a three-prong approach. So when I looked at who was on my team and who I had connections with already, it was easy enough to at least start within the university. So because the Division of Pediatric Trauma Surgery was so gung-ho about this, I decided she and myself needed to be the center of this, because two heads are better than one at the center of this leadership triangle. And then we had secondary leaders, because I was getting med students out of the woodwork just cold emailing me about this, which was blowing my mind. So somehow it was getting out. And med students were perfect, at least in my leadership structure, because we have direct access to them. We're all their mentors if we have if we have appointments in the university. They're incredibly capable. They're smart folks. I mean, they got into med school, and a lot of them have made their own teams before. We could have a reciprocal relationship because each of these students needed a capstone project, and they all wanted publications and things like that to get into competitive residency programs. And this program could provide that. And last but not least, they have their own internal leadership structure. So the medical students made us into an affinity group where they then turned over the leadership every year, because for the first year of medical school, you have the most time to devote to something like this. So here's our team. The two leads are me and Dr. Katie Wong. She's incredible. And again, just very involved, especially from the pediatric trauma surgery side. And then the team itself. So here were our first team leaders. Curran was our awesome med student who connected me to Dr. Katie Wong. He took over the swim portion and started making connections within the community about how to use pools. The second is Teresa. Teresa worked with me in the city to work on, like, what's the data behind signs? How can we update signs? And what signs are best for our multilingual, multi-racial community? And then the third is Dan. Dan had some connections inside the school. His capstone project was in hands-only CPR, and he really wanted to take on the anti-drowning and CPR portion of this. So this was taken from actually one of their recruitment slides. In the first year with these three leaders, we did a lot. Curran established an 8 to 10 week water training program and had a partnership with the YWCA to use their swim instructors plus our medical students to go in the pool, and had like a short program to give these kids some competency in the water. Second, Dan started talking to schools, seeing how we could get in the schools, and just like scoured to see who the new superintendent was, and just started like power mapping that whole arena. And then in public safety and awareness, our most valuable connection is Elvin Familia, who is the brother of the officer who tragically died. He has his own foundation for anti-drowning, who supplied all of the police officers in Worcester and the surrounding areas flotation devices and taught them how to use them, and was very interested in making sure that no other teens in the city that he grew up in and loved died of this preventable illness. So we've had some successes. So one, I think we're really good at keeping the community and our people forward, especially with Elvin and the story Elvin has. Whenever we go into a meeting with a city manager, with a superintendent of schools, with anybody, Elvin is always with us. He's always at the forefront and always there to tell his story. Second, we trained 40 kids out of water. That's a pretty big deal in your first year. We have med students presenting on this at national and regional conferences. Again, we had meetings with the city manager, and we're going for some pretty big grant funding now to try to get this funded and get it going in perpetuity. But there's also challenges. It's challenging to keep the city engaged because the city itself has a lot going on, right? Your passion project is not exactly number one on their agenda. So it takes constant nurturing of that relationship, which I think nurturing is a kind word, but the real word is badgering. You email people a lot to make sure they stay on your side. Second, you have to be constantly adaptable. So we couldn't get into schools this year. We probably won't be able to get into them next year because the new superintendent is so focused on the Worcester school system having a very stringent curriculum. So we're looking at other avenues to get this at-risk community more water safety training. And then, of course, funding. So our goal for this year is one, to teach this anti-drowning program again with CPR, and two, actually get kids in the pool because we have all the infrastructure there. It's just busing and physically getting those kids to those areas. So I think we covered the objectives pretty well. And the take-home points are, one, if you build coalition, understand why you are doing this. There's a lot of hiccups. There's a lot of stop and start. So you need to keep your morals and your reasons at the core of everything you do because the passion will shine through. Second, you got to find their people and use your privilege to help elevate their voices to create change. Three, the key to power is relationship building and sustaining. And four, giving up total control of your organization and not having your hand in every single moving part is the only way for an organization to grow to its full potential. So I'm going to leave you with this quote. And anybody have any questions? Thank you guys so much. I know I talked at you for a while.
What do you think was the toughest part of this? Was it finding the problem or coming up with engaging the community or getting funders? What was your biggest challenge?
So I think the biggest challenge again is finding that power, because again, this is such a multi-pronged comprehensive program. So we have 3 separate power maps and we're finding 3 separate focuses of power. And once we think we have something and we think we have a relationship with power, we then realize, oh no, there's somebody more powerful than you that's hamstringing you. Like, we got this whole thing together with YMCA, but we realize who really has the power to stop our swim program from occurring is the busing companies, because we have no way to bus these kids to our program. So now what do we do? So I think that's the biggest issue and the biggest challenge.
Someone asked if you could put that last quote up again.
Oh yeah, for sure. Sorry, I don't really here. I'm going to look in the chat too.
I'm monitoring it for you.
Oh, thank you. Oh, sorry, this is a very sensitive program. There we go.
Hi, Dr. Valenti. This is Mr. Hayes. I have a question. So I was born and raised in New York City, and pretty much in Harlem. So other than the youth programs that we basically had locally, there was no busing. You either took the train or took the metro.
Yeah.
A lot of people who grew up in the cities, they tend not to leave their environment. Our safe zone is the 4 or 5 blocks that we grew up in. That's where we feel safe. So my question to you is, did your data, or did you look at where you have those who are dealing with the minorities that you're talking about, and There's other reasons I think why, African Americans don't swim. My parents never swim, their parents never swam, and there's historical reasons behind that. But have you ever thought about actually putting your program where they're actually at, as opposed to not busing them? Because yes, it's nice to build 40 people, but what happens in the next year when, like you say, we may not have busing, or the powers of being may not like it anymore. So did you ever look at that? Thank you.
Yes. Everything you're saying is completely resonating. So there are 5 pools in the city, and we actually just got off the meeting with the YMCA about this because the YWCA needed busing. The YMCA was like, look, we are one of the only organizations in the city where we and all the other youth organizations are one organization. And we know all the pools, and we need to get this in every single pool so kids can walk here. And that's sort of our goal. Right now, we just want to have the test group. And because, again, busing is an issue, we're working to get the kids who are playing basketball at the Y to do something where, like, yo, if you want to play basketball here all summer, that's cool, but you got to show you're proficient in swimming. Just something. So to get kids where they are.
Thank you.
That's super important. Thank you for bringing that up, because that is something that definitely resonates.
I do have a follow-up question. Is any of the local schools in those areas have a swimming program?
No.
None. Okay. Thank you.
We do have a hand raised, it looks like. Tabitha?
Yes, good afternoon, early afternoon or late evening to all. Dr. Valenti, thank you for your presentation. This is such a hot topic. It's amazing. This is a conversation my family and I have all the time. I'm one of those parents who did not swim, and I as well. Mr. Hayes grew up in Newark, New Jersey, so go figure. We went to the Hayes West Pool. I thought that was a coincidence too, that you spoke up, but you're right. I think the engagement locally within, their corridors would be helpful. But one question that came to my mind is around the engagement of the parents. So here I am, a mom, and my daughters are just adventurous by nature, right? And so they didn't get it from me because I'm terrified of water. I can get it up to my ankles and I'm good. But have you guys thought about engagement of the parents, like maybe at the parent-teacher conferences through the school, to kind of provide them with education around the swimming, et cetera? Has that been a thought?
Yes. So again, that resonates with us too, because especially parents who are non-swimmers, this is a scary topic to throw your kids in a pool. So we, right now we're working with one of the city officials who her whole job is to connect different community organizations. And, if we can't get into a parent-teacher conference, we're hoping we can at least talk to people through those community organizations and have parents involved. Also, we're trying to get stuff in through the pediatric ER because, kids wait there a lot, and it's low-hanging fruit for us because I'm an ER doc and my partner is a trauma surgeon, so we're there all the time. So just some sort of messaging there to get community members and parents more knowledgeable. But yeah, do you have any other ideas? Because I'm all ears.
It looks like we also have Helen hand raised.
Mm-hmm.
Hi, Dr. Valenti. Hi, everyone. This was a great presentation. I'm sorry, my dog is barking at something. I'm trying to run to another room. But anyway, I wanted to share a story just really briefly. About 2 years ago, I was working at a facility and we brought in an 18-year-old young man who had gone out to hang out with his friends for the first time. His mom had let him hang out with his friends. Not like that, but you know what I mean, just hanging. Mm-hmm. And there was a pool and he was pushed into the pool as a joke. And by the time the police officers got to him, there was so much debris at the bottom of the pool, they couldn't recognize him. Mm-hmm. They couldn't get to him in time. So naturally, he was brought into the ER, brought into critical care, and he died there. Mm-hmm. And it was sad because nobody around could help him, no one. So this was great for me to hear. I don't know how to swim. My kids know how to swim, but I thought this year would be the year I learn how to swim. So thank you for sharing this information to us.
Well, thank you for listening and thinking it's valuable. I appreciate your comments and your story, because it's true. And as a healthcare professional, I hate seeing death. I have to see it, and I especially hate seeing preventable death. So, thank you for sharing that.
And I want to second what Helen said. This has been an excellent presentation, and it's also everywhere in the chat. Thank you very much. I wanted to point out that I'm a good swimmer. I've been swimming since I've been very, very young, and I'm a good swimmer. But when I lived in San Diego and I went to the ocean, I got caught in a jet current, and it scared me. It tumbled me. I didn't know which way was up, which way was down. I didn't know if I was going to surface or not. It only lasted maybe 10 seconds, but it felt like a long time, and it was very scary. So I hope that as you're teaching people to swim and whatever, you also let them know of the dangers of water, and also that, it's a lot different swimming in a pool than it is the ocean, and they need to be so careful, because it is, like I said, I'm a good swimmer, and I was very scared. So, but this is wonderful. Kudos to you for doing this. This is very impressive. I'm just really amazed and impressed that you took this upon yourself and you made all this happen. So congratulations.
Oh, well, thanks. It's using your privilege and your power to help. And I agree with you too. A lot of our training and a lot of our anti-drowning is based off of natural bodies of water, because that's where teens die. And we teach about rip currents. We teach about, sudden drop-offs. We teach about cold water shock, things that would kill anybody. So yeah, thank you. And if any of you have any other ideas, please, like, the whole point in leadership and coalition building is the more ideas, the better. If anybody in their is just thinking about this, please shoot me an email. I'll put my email in the chat, because I would love to hear from whoever, and all ideas are welcome.
Dr. Valenti, we've got one more hand raised. Sheila?
Hello.
Hello.
I live in Alaska. I'm on the Kenai Peninsula. So as you can imagine, drowning is a big issue here, that river that runs right through, and the very, very cold ocean. And so in Alaska, we have a Kids Don't Float program.
Yes, I've
So
seen that.
You're familiar with that? Yes. And I believe it was originally a grant funded program. And so for those that don't know what this is, there are life jackets at all bodies of water at different points that are just there to use. And so people will use them, return them, and also then just the parks and everything try to make sure that there's like an even distribution. If they're out doing cleanup or things, if there's a bunch at one place and not at another, they'll take them back over. But it has definitely been helpful in this area. And then I also, beyond just the swimming things, this was really timely for me, as we are working on with the tobacco quit line at this point, really looking more at vaping or e-cigarette use, looking at trying to form a community coalition here. So great timing on the coalition building information.
Awesome.
For me. Yes. So I wish you all the greatest success in this. It is absolutely a worthwhile thing.
Yeah, I wish you too.
Thank you.
Dr. Valenti, we had a question in the chat. Do you have any ideas on how to decrease fear? And what Carwin said is, my mom's from the Caribbean, and she instilled fear in me. I learned to swim at the YMCA as an adult, but I still have a fear of swimming.
So I honestly don't know. I think the only thing I can think of, and that we focus on to decrease fear, is just exposure and knowledge of risk, and knowing, because if you take any risk, your whole risk is sort of in your sphere, right? And everybody has a different level of risk that's acceptable to them. So the most we can do is show people what the risks are and show people how to be safe. But I think fear has a big determination on what level of risk you're willing to take. And it's really hard. to decrease that or even eliminate that in folks, especially when it's so deeply instilled from your parents and your community and institutionally. I don't know if anybody else has any ideas.
Some people have said that they need to leave, Dr.
Okay.
Valenti. So just to wrap up, we want to thank you for taking your time and presenting this. There's a lot of doctoral students on the phone and a lot of faculty members. And I'm sure that not only does this translate to what you're doing, but in a way it also translates to how to prepare and complete a dissertation, because you have to know the problem, you have to know the significance, you have to know who the people are to go to, you have to talk, and you have to work. And you have to build some kind of coalition or some kind of sustainable change where you can measure the outcomes in order for that change to stay sustainable and to build on it. So there's a lot of takeaways. So I really think that this was helpful to a lot of our doctoral students.
Well, thank you. And thank you everybody for having me. This was a lot of fun, and good luck with everything you're doing. And again, if you have any ideas on our program or anything that jumps into your brain that you think would be of any help, or any ideas or questions or concerns or any questions afterwards, please feel free to email me. So thank you.
Thank you.
All right. Bye.
Bye-bye.